thank you. That was a really nice introduction. And I will say that actually you did inspire my career. If you can believe it, I took classes at Penn as an undergrad, and you know, one of the things I learned in these classes is that the U.S. was the only developed country in the world without a national health program that covered everybody, and I decided that that's what I wanted to do with my life when I was 17 or 18 or whatever, 19 years old as an undergrad. So as Professor Pauly said, I worked on the ACA. I was the Chief Health Counsel of the Finance Committee, which is one of the 2 committees of jurisdiction in the Senate. There were 3 committees in the House. So I was part of the drafting process, and in pretty much most or all of the major meetings where all the decisions were made. So if you do have questions on why something is in there or not in there, I can probably give you my 2 cents worth. And then I went to the White House, first HHS and then the White House, but in the administration to work on implementation. Insurance market reforms, I think, was the fundamental key part of making the insurance market work, along with the requirement to have coverage and to make the system more fair. While we were debating the ACA, it turns out my parents retired and moved from Kansas to Las Vegas. My mother didn't have retiree coverage. My dad was eligible for Medicare, so she went to try to buy coverage in the individual market, and she had a pre-existing condition, and they could not find a company that would sell her a policy. My dad was a doctor, had plenty of money. They were willing to spend a lot of money to buy coverage. Nobody would sell her a policy. And so she actually ended up going back to work for $8 an hour as a gate agent at US Air, part-time, 20 hours a week was all it took to get health insurance, but just for health insurance. And that's what she needed to do to get covered. And in a system that doesn't work very well, it was impossible for her to buy coverage. And all of this was happening. My mother actually she was a Republican for many years, and we had all sorts of debates. But once she faced the healthcare system in the US, I think, and so directly and so personally, she's actually done a 180, and she's now 100% in favor of Obamacare, and that's also been interesting.